The reported prevalence of hypoplasminogenemia, or type 1 plasminogen deficiency, is approximately 1.6 affected individuals per million population. It affects both males and females. However, this prevalence was arrived at through analysis of blood donors in different areas of the world. Therefore, we do not know in real life whether this reported prevalence represents the actual number of individuals who are affected throughout the world. In fact, there are many individuals throughout the world who are undiagnosed because the disorder is so rare and not recognized. So it's difficult to know how prevalent it really is. One of the difficulties with the disorder is because the symptoms may present in many areas of the body, individuals who are affected tend to present to different physicians. For example, they may present to their pediatrician, their internal medicine doctor. They may be referred to an ophthalmologist, an ENT physician, a pulmonologist, many other different physicians. And because this is a rare disorder, it's very difficult to educate all of these different specialties about this disorder. Once the diagnosis is made, it's important for individuals who are affected with plasminogen deficiency to be cared for by a physician and a program, a practice that understands the multidisciplinary methods that can be used to help patients and the multi-system manifestations of the disease so that they are identified early and cared for in a coordinated fashion. Unfortunately, I've spoken to many patients whose diagnosis has been significantly delayed. Some individuals, unfortunately, up to 40 years. Not getting a correct diagnosis can lead to the development of permanent disability or sequelae of the disease. For example, individuals can lose their eyesight, they can lose their hearing, they can lose their teeth, they may have chronic obstructive pulmonary disease and other manifestations. Therefore, getting a correct diagnosis is critical. And one of the important initiatives is trying to shorten the journey from the presenting of symptoms with individuals with the disorder to the diagnosis that is correct. Once the correct diagnosis is made, at this point in time, there is replacement therapy for plasminogen deficiency. This replacement therapy has been transformative for patients' care and outcomes. We've seen individuals start this therapy and have their symptoms melt over a period of weeks to months. We've had patients who have had years of symptoms, and it may take longer for some of those symptoms to resolve with replacement therapy due to the length of time that the lesions have been present in different organs. But replacement therapy has really transformed the treatment of plasminogen deficiency, just like replacement therapy transformed the treatment of hemophilia many years ago. For families and individuals who are affected with this disorder, I think when I speak to people who don't have access to therapy, they are the ones who are most afraid because of their ongoing symptoms and their inability to address them effectively. This is very true for parents of young children with this disorder, as well as adults who have this disorder. They feel powerless to be able to help their children or help themselves overcome the symptoms of this disease. In the United States, where treatment is available, I think that some of the feelings that patients and families have is a little bit different. They're relieved that therapy is available. It is intravenous. That may cause anxiety in the beginning about how to administer it, the fear of, for example, hurting their child with an intravenous injection, or the fear of self-injection. I think these things can be overcome with time, as it has with hemophilia, but that is a hurdle for families and for patients to deal with. However, once they deal with this, I feel that they have a greater sense of control over the disorder and ability to control it. Every person's journey and story with this disorder has stayed with me, which is what motivates me to continue our work in plasminogen deficiency. We speak to patients throughout the United States and throughout the world to discuss their symptoms, to discuss their therapy. We speak with their physicians, and every story is touching in terms of how it's affected the individual's life. And when they are able to get treatment, which many patients throughout the world are not yet able to access, that has been transformative and just a beautiful journey to watch as they recover their health and are able to participate more in their lives as active individuals.